Welcome aboard, everybody. Dr. Glidden here with my take on seasonal allergies. It's that time of the year again. Did I hear you say achoo? Well, there's a lot to know about allergies that your medical doctor does not know, and that the pharmaceutical industry also either knows and keeps you in the dark about, or quite frankly just doesn't care. There are simple steps that you can take to deal with seasonal allergies. I'm happy to lay it all out for you. Conventional medical doctors own the show, and MDs practicing allopathic reductionistic medicine have been in charge of the medical marketplace in the not-so-free world for the last 100 years. They've kicked the chiropractors, the naturopaths, the homeopaths, the herbalists, everybody else to the curb. And the MDs have convinced you that they are the exclusive go-to people for everything having to do with anything medical, and quite frankly, it's simply not true. Your medical doctor does not know what's best for you. They only know what they've been trained in, and what they've been trained in is one tiny piece of the pie of medical science. It's referred to as allopathic reductionism, and allopathic reductionism argues that when it comes to allergies, it's all about the pollen. It's all about the allergen. And quite frankly, it's not. As a matter of fact, if you look at the statistics of allergies just in the United States each year, consumers spend $11 billion. That's billion with a B. That's a hefty chunk of change. And keep in mind, no cure anywhere in sight, right? It's simply symptom management. Well, if you're happy with symptom management, then, God bless you and have a nice day. But if you know somewhere in your mind, somewhere in your heart, somewhere in your body-mind gestalt, that there must be a better way, well, you're entirely correct. There is a better way. It's the naturopathic way. And let's think about this concept just for a minute. If it were, in fact, the pollen, or the cat dander, or the horse dander, or the dog dander, or the dust mite that was in fact the cause of the allergic condition, then everybody would be allergic all of the time. Everybody that breathes in the pine pollen, everybody that breathes in the golden seal, everybody that pets a dog or a cat, or lives in a house where there are dust mites would be having allergic reactions. But only a small percentage of the population has allergic reactions. Well, that's not entirely true. It's about a third of the population have allergic reactions, and this is an untenable situation, but it's not because of the allergen. The allergen is the trigger. The trigger is triggering a set of biochemical reactions that can only happen in a system which is out of balance and weak. When your system is healthy and strong, you can be exposed to all of the allergens on God's green earth, and nothing will happen to you. And this is the naturopathic vantage point. This is the holistic vantage point. This is what we're going to talk about right now. There's a whole bunch of stuff about the allergic condition that is so far outside of your reference range that you didn't even know you didn't know that. Again, if you're happy with suppressing and managing your symptoms with $11 billion of prescription medication and over-the-counter pharmaceuticals, then God bless you. But if you want a different alternative approach, even though I hate that word, naturopathic doctors do not practice alternative medicine. We practice naturopathic medicine, which is in fact a rational medical science, science-based, clinically verified medicine. Let's get into the nitty-gritty, and let's understand the nuts and bolts of the allergic condition. Interestingly, the first, second, third, and fourth things to consider when you are dealing with seasonal allergies are not the pollens that you're exposed to, but the food that you just ate. This might come as a eureka moment for many of you, and I hope that it does. There is an intimate relationship between the stuff that you eat and the stuff that you drink, and the exaggeration or exacerbation or even a birth, quite frankly, of an allergic symptom. Everybody that has allergies, seasonal allergies, knows that there are certain times of the day when their allergies flare up. Certain times that everything gets much worse. And the first thing that people think about when they do have an allergic flare-up is, oh, there must be pollen that I just exposed myself to. I must have just walked through an invisible pollen blanket, right? Well, sometimes, in fact, it is an extra dose of pollen that can upset the apple cart, but most of the time, it is not. Most of the time, it's what you just had to eat or what you just had to drink. Let's take a look at this because it's an important point to ponder. And this one piece of free information can make a dramatic difference in how you navigate the weeks or months out of the year in which you are allergically compromised. So, when you have an allergy attack, here's what I'd like you to do. Look to see the very last thing that you had to eat or drink. When your allergies flare up, the very last thing that went in your mouth, I don't care if it was a Tic Tac, you write it down. And by the third or fourth time that you have an allergy attack, there will be things on that list which are the same thing. Those are the foods or the drinks that you need to avoid during allergy season. And by the way, this is always a delayed reaction. It's never immediate, like you swallow the Tic Tac or chew on the piece of gum or have a Coca-Cola or eat a cookie or have some ice cream or have a cheese sandwich. It's not an immediate reaction. It's always delayed. 5 to 45 minutes after you eat it. Sometimes it can happen a minute or two after, but usually it is in fact a delayed reaction. So you need to be mindful, and this is why it's easy to miss the relationship here between food or drink and the exaggeration of a seasonal allergy. Now, once you discover the foods and or beverages which are exciting the allergic condition, then you just remove them from your diet for the remainder of the pollen season. Pollen is a factor here. Pollen is at play. But what will exaggerate your symptomology to a remarkable degree is stuff that you eat or drink, because there is an intimate relationship between your digestive tract and your immune system. I guess your MD forgot to inform you of this relationship. Just understanding the relationship between food or beverage can be a great boon to people suffering from seasonal allergies, because by identifying and eliminating the food culprits, you can dramatically ease your symptomology while we're attempting to strengthen the system with medical nutrition. Now, amongst the holistic strategies which are available for allergy relief, perhaps none are better than good old-fashioned homeopathy. Now, I've been a classical homeopath practicing homeopathic medicine clinically for 26 years. And homeopathy is an interesting science. And the classical homeopaths in the world, myself being one, will tell you that homeopathic medicine is never prescribed on the diagnosis. You know, I could have 10 patients. I could have 3 patients. I could have triplets. They all have exactly the same genetic structure. Identical triplets. They all have an allergy to, ragweed. And it is entirely possible that in order for them to secure relief through homeopathy, they would each need a different medicine, a different homeopathic medicine. Keep in mind, in order for a homeopathic medicine to be effective, to bring you relief, to get you on the other side of any health condition, the medicine must be prescribed with 100% exactitude. There are 3 homeopathic medicines which I find I prescribe most often during this time of the year. But you must pay attention to the symptoms in order to hit the bullseye with the homeopathic medicine. A typical homeopathic medicine at the health food store will cost you anywhere from $8 to $12. Homeopathic medicine is impossible to hurt you if you take it the way that I recommend you take it. The worst possible thing that can happen if you try a homeopathic allergy intervention is that it just won't work. No harm, no foul. It's worth a try, because when you hit it right with the correct homeopathic medicine, everything changes and it is a remarkable experience. So the 3 homeopathic medicines to consider: Allium cepa. Homeopathic medicines, of course, are designated by their Latin terminology. All 3 of the homeopathic medicines that I'm recommending here are herbal in origin. Allium cepa is a homeopathic medicine made from onion. Isn't that interesting? Bland, watery eyes. Bland, watery eyes. Burning nasal discharge. Burning, clear nasal discharge are the hallmarks of an Allium cepa homeopathic prescription. So if your allergic presentation includes watery eyes, but the tears coming out of your eyes are bland, they're not burning, but the stuff coming out of your nose is in fact burning, or the stuff going down the back of your throat is burning, then give Allium cepa a try. Euphrasia officinalis is exactly the opposite. Burning tears and bland nasal discharge. Burning watery eyes, and the stuff coming out of your nose is bland. Euphrasia officinalis is exactly what the doctor ordered. And last but not least, very interesting medicine is called Wyethia. The symptomatic expression of the need for homeopathic Wyethia is: during your allergies, a significant symptom, a significant component of the expression of your allergic condition, in addition to, of course, the eyes and the nose, is a burning, itching more than burning roof of your mouth. So if you've ever noticed that you're scratching the roof of your mouth with your tongue during allergy season because it's just so itchy, then give homeopathic Wyethia a try. You're going to love how it makes you feel. The recommendation: find these medicines either in the 30C or the 200C strength. 30C like Charlie or 200C like Charlie. Take 2 pellets orally 3 times a day and 2 pellets during a flare-up. By the way, within the first day, within the first 12 hours of taking the homeopathic medicine, you will know whether it's working or not. You don't need to wait 7 days to see whether the homeopathic medicine works. If it's the bullseye remedy, if you've hit the nail on the head, if you got lucky with one of these 3 medicines, you will know within 12 hours whether or not it's working. If it is working, then you start and stop as needed, the same way that you would with a cough medicine. If after 3 or 4 or 5 doses of it, it doesn't change your symptomology whatsoever, then find a licensed homeopath that you can work with to help you hit and find the bullseye homeopathic medicine. Next on the list is good old-fashioned herbal medicine. Herbal medical intervention for many different health conditions is an extremely effective, time-tested, safe, and effective medical intervention. Now look, herbal preparations are like chicken soup. They're not all created equal. It's the recipe. It's the method of extraction from good old Mother Earth. It's the method of preparation. What do you use to extract the active ingredients from the plant? How long do you let your herbal concoction sit during the extraction process? There are many variables which need to be taken into consideration in order to make one herbal product run-of-the-mill, one herbal product kind of, better than the rest, and other herbal products extraordinarily excellent. Well, if you're going to spend hard-earned money on herbal medicine or vitamin therapy or something not covered by medical insurance, it would be perhaps smart for you to get the best stuff around. My favorite herb company that's available over the counter is a company called Good Herbs, and their product Lymphatic Health is not to be overlooked as a tonic, an overall immune supporting strategy to take and use during allergy season. Your lymphatic system is intimately related with your immune system. Your lymphatic system is intimately related with your immune system, and it is only a smart thing to do to give your lymphatic system support during seasonal allergy season. Good Herbs Lymphatic Health, a half a teaspoon per 100 pounds per day. You can take an extra teaspoon or two during allergy season. You can get Good Herbs through the Longevity Company. I am a gigantic cheerleader for longevity because in 26 years of clinical work, the therapeutics developed by the founder of Longevity, Dr. Joel Wallach, and the products delivered by Longevity eclipse in effectiveness anything that I've seen. Longevity products are the most effective nutritional products I've seen in 26 years of clinical work. Now, we need not overlook the obvious, right? If we're dealing with seasonal allergies or any type of an acute health situation, it would be prudent to give the body foundation medical nutrition support as an adjunctive to the acute health improvement strategy. The single best way to do that during allergy season is this combination of products, Longevity's Anti-Aging Healthy Start Pack 2.0. 1. Anti-Aging Healthy Start Pack 2.0 per 100 pounds of body weight per month lays a most excellent foundation for your body to recover and optimize its structure and function, and to help you get on the other side of seasonal allergies once and for all. If you'd like more information, which you should, please visit my website, drglidden.com, become an insider. I have over 120 hours of videos. I talk about everything from acne to xenophobia, what the MDs think about it, why they're wrong most of the time, their treatment strategies, which are old-fashioned, juvenile, Machiavellian, and monopolistic, and more importantly, the holistic naturopathic view of chronic disease, and most importantly, what you can do with science-based, clinically verified, holistic medical interventions to help your body recover from a chronic disease. Until we meet in person, I remain your steadfast advocate for health, Dr. Peter Glidden. See you around campus.